A joint is defined as the part of the body where two or more bones meet to allow movement. And the health and wellness of joints in our performance horses is extremely important. We asked Dr. Christopher Baldt to come back on the Post Time Show to teach us a little about some joints in the equine body. Take it away, Dr. Baldt.
The knee joint is also known as the carpus. So there's 8 small bones that form the knee in a horse, and they're cuboid or cube type shape. And so in between the carpal bones is cartilage. As the horse bends its knees back and forth, they could develop a tendonitis or irritation in those bones and create some sort of swelling around the knee. It's not common for a standardbred to have a fracture in the carpals, unlike thoroughbreds, because standardbreds are a little better balanced when they're running, but it is very common to have musculoskeletal or ligamentous type injuries that respond real well to conservative care. Ice, rest, wrapping, PEMF therapy, ultrasound, gentle soft tissue or bony manipulation is always a benefit, and some of the non-steroidal anti-inflammatories are always very good for carpus problems. One of the most important things when you're trying to figure out what's going on with your horse is observation. So first you take a look at a static observation. You look at the size of the knees compared to each other. You also look at the position of the hoof, and then you look for inflammation, and then you can also check for tender points. That's one of the easiest things you can do. You can actually get a little more scientific, and some people do bone scans. Some people do x-ray to see what's going on. So there's many different avenues that people will take in order to find this type of problem. When you take a look at a horse, you know we have a hip joint, okay, as we do as humans. They have a hip, and they also have a knee joint. The knee joint's also known as the stifle joint. And the stifle has a small sesamoid-like bone. It's very analogous to a human's kneecap. That allows for the tendons to open and close while the leg is being moved forward and backwards through propulsion. And so stifle injuries, because standardbreds use most of their impulsive forces come from the back, are one of the most common musculoskeletal problems that a standardbred horse will have. The sacroiliac is a joint comprised of 3 bones. The sacrum, or some people know it as the croup, some people call it the whorlbone, the ilia, which are also known as the pelvis bones, and where they come together is a joint called the sacroiliac joint. As we've mentioned, standardbreds get their impulsion from pushing off on the back. The banking of the tracks under, over, the camber of the track itself, the way it's arched, often puts a lot of strain in the sacroiliac joints. When these joints get troubled, they'll begin to short stride, or they'll start to run out, run in. You might see the head forward, but the tail off to one side, or the hind end off to one side, or the hind end on the other shaft. And it also may start to look like a hock lameness also. So one of the first things you could do a little palpation, see if there's any soreness. So you can see he's a little sore on this side. We could check on the other side. So you can see he has a little soreness on both sides. So we would say that he has maybe a bilateral sacroiliac problem. One of the most important things to do is to find out what the trouble is. So one of the most important things that we could do is we observe the horse walk. You want to check their gait out. And then you may do a palpation or feeling of the joint, looking for muscle tension, inflammation, or reactivity. When you press on a joint that's hurt, sometimes you'll see the horse will rotate its pelvis. So we know he may have a little issue in this joint right here. And so what we could do is we could do some therapy on the horse, where you could do some PEMF therapy where you increase circulation. We could do some manual therapy where we reposition or realign or move the joint so it moves a little more properly through like a chiropractic adjustment. We can also do some techniques where we relax the muscles. We can release the tension in the hamstrings. And there's a bunch of things that we can do to actually improve this joint function very quickly.
That was yet another wonderful lesson from Dr. Baldt. Thanks to the doctor for taking the time to teach us more about our horses we love so much. Don't forget, you can see so many of Dr. Baldt's segments on our YouTube channel at youtube.com/Posttime Show. And of course, if you would like to contact him, just log on to his website at drbaldt.com.